Aloha again. If you have not visited realage.com, be sure you do that this week and just let me know what you find out. Mine is exactly 5 years younger than my chronological age. So that's not bad for an old broad, you know. There's still some of you in this class, or some of this class, those of you who are listening to this are not in that group, I'm sure, that haven't kept up to date with us. So if you see any of the other students that have been in the class but aren't taking part with our online class, remind them to check Laulima and to do the work, catch themselves up. I'm going to talk a little bit about the physical changes that take place in men and women in this age group. For the females, there's a drop in their estrogen and their progesterone. They might have hot flashes, some vaginal dryness, and maybe even some urinary dysfunction. They have less frequent, quicker orgasms, but they still do have them. But it does mark the end of a reproductive ability. Excuse my voice. I think my vocal cords are wearing out on me. So there are some physical and psychological changes that are symptoms that are reported for menopause when a woman moves from having regular menstrual periods into not having any. So she might have some joint or muscle pain. She might have headaches or even insomnia. She might be more tired, a lot more fatigue and dizziness even. Generally, there's a little weight gain. If you watch some of the videos I showed this last week, you'll see that weight gain is one of those things. They might have some constipation, irritability, definitely that, nervousness and anxiety. Some of them go through a lot of depression. For the male, the changes that take place is that there's a drop in their testosterone, and there's a loss of psychological arousal. They have less frequent erections. Their orgasms are slower, and they take a little bit longer to recover between ejaculations. There's also an increase in a risk of erectile dysfunction. There are pills that can take care of that now. Reproductive capacity continues, but the fertility may decrease. And I think something that we have discussed before in terms of people who can't get pregnant or who end up with Down syndrome babies. It's old eggs and old sperm. So just remember that. So the man still does have sperm, but they may not be as viable as they have been in the past. Now, for the male, like the woman has menopause, the male has a climacteric, that's what we call it. And again, some symptoms that are associated with that would be depression and anxiety, irritability, maybe some insomnia and fatigue, weakness, lower sexual drive, maybe some memory loss, reduced muscle and bone mass. They haven't been keeping up their exercise. Some loss of body hair, perhaps, and an increased frequency of erectile dysfunction. Women seem to know their sexual needs better than men, and women feel freer at this age to take the initiative. They have more interest actually in sexual ability or activity than men do. Men have slower responses, but in a way that can actually increase the pleasure, because sometimes with young people it's too fast. But as you get older, we take a little bit more time and slow enjoy it. And also, you know, men and women probably have a little more time and privacy at this age, so they can take longer periods for sexual activity. and they have times for just cuddling that might increase their feelings of intimacy. So think about what ages your parents are, for example. How often do you think your parents have sex? Oops, people don't want me to ask that. Most people generally underestimate the frequency that their parents engage in sex. But I've told students before in some of my human sexuality classes, can you ever imagine stopping what it is that brings pleasure? So it doesn't end just because you turn 20 or 25 or even 40. It just doesn't end. You keep on going and you keep on being sexually active. But some of the cultural attitudes towards sexuality is they make fun of it, a lot of people. There's a lot of stereotypes, sexual stereotypes that are associated with aging. And if you have ever watched anything like the old Golden Girls or anything with an older person in it, you'll see that there's usually a lot of comedy around it. But, is menopause ever discussed? Or is it really basically kind of ignored? How about a man's ability to perform? How many times do we discuss that? When I have done premarital counseling with couples, and I will say, what happens if he can't get it up sometime? And they'll say, oh, that'll never happen. I said, trust me, it will. Anyway, there's a lot of food for thought when you start looking at the sexual activity around this age group. So there are some other physical changes that are associated with aging. Visual changes, of course. Hearing changes. Sometimes the touch is less sensitive. Taste could be less sensitive. Usually there's some loss of strength unless you're really keeping up your physical activities. I know that I was lifting weights at the club, not at the club, but at Fitness Forever, which is where my membership is. But once I had my back surgery, I haven't been back, and I can really tell that I've lost a lot of my muscle tone. So there's a loss of endurance. We simply can't go hiking for as long as we used to. We may have a slower reaction time. And I think about driving, and it's not, young people will have a faster reaction time, but older people also know what to do more quickly than a lot of young people do if they is about to have an accident. They say that older people sleep less. I think I sleep more. So all of these, as you probably know, are very much generalities. Loss of temperature regulation. There are times when I'm freezing to death, other times when I'm burning up. Our immune system is probably less efficient, and our oxygen use, or our vital capacity, decreases. One of the things that I have noticed, like I said, is because my vocal cords are getting worn out. I don't know. Too much preaching and teaching over the years. But the leading causes of death in the elderly, of course, we know that heart disease is still number one. Stroke, kidney disease, cancer, lung problems, lung disease, pneumonia, and influenza. And that's one reason why this coronavirus is so difficult, because it usually, for the older people, takes them right into pneumonia or any kind of a lung problem. Diabetes is another one, and accidents, just falling, for instance. Alzheimer's and just general dementia often comes along. Septicemia, or any kind of an inflammation in your legs, for instance. As you get to be a grandparent, though, there are some activities and fun things that you can do as a grandparent, with your little ones, joking and playing with them when their parents are too tired, or maybe giving them a little bit of an allowance, some money. Watching TV with them might be another one that comes along. simply talking about past events. I know my grandchildren are all in their late 30s and early 40s. So it's not like they're little kids wanting to talk with me. But we still talk, and they are interested in family history, finding out more about where they came from. We can offer advice if they want it. They'll come to us a lot of times for advice where they wouldn't go to their parents. We can discuss their problems if they have any, or how to discipline a child. We can even help with that. Going on day trips with kids. We can teach them games, we can teach them skills. And oftentimes we end up settling disagreements between them and their parents. So I have a couple of more things that I want to talk about. Oh, ways life expectancy can be increased. Dietary restriction, of course. Just simply eating fewer calories. Reduction of free radicals, and there are all kinds of supplements that you can take and foods that will help with that. Reduction of weight, keeping your weight down. My weight, I lost about 40 pounds maybe 15 or 20 years ago, and I've kept it off. In fact, I have even started losing a little bit more. But I'm much healthier because of it. And then just simply doing what you can to reduce cancer and heart disease. Increase your exercise if it's nothing more than just walking around the block. I want to just mention too that sometimes the question comes up about creativity in older adults. So I'm going to give you a list of some names that if you're interested in looking them up. But Frank Lloyd Wright, the architect, for instance, his creative period really spanned more than 70 years. And he designed more than 1,000 structures. Agnes DeMille continued to choreograph ballets into her late 70s. Darwin wrote his scientific articles and books well into his 70s. Louis Pasteur, who was still making discoveries when he died at 72. Helen Mirren, one of my very favorite actresses, at 61, won an Oscar. She'll be 75 this summer, and she is still acting and taking good parts. I love watching her in the movies. And then Churchill, he was Britain's prime minister, ended his career as Britain's prime minister at 81. So don't ever feel like there are things that you lose, and sometimes those things improve as you get older. There's also Grandma Moses. I don't know if any of you have heard of her, who became quite an artist into her 90s and her 100s. So next week, I'm going to give you a chance to ask me any questions that you have about getting older, I should say. I'll answer all of them. There isn't anything I'm embarrassed or afraid to talk about, as you probably have already discovered about me. But next week, we're going to look at some more aspects of aging, and that's it for today. Aloha, stay safe, wash your hands, wear your mask if you go outside, and stay inside as much as you can. Talk to you later. Aloha.